Dr. McBride, back again for part 2. We talked about post-traumatic stress disorder, how the brain, the amygdala, and our bodies respond to trauma, and how we can manage that, shut off that response so we can get comfortable in our environment. That sounds easy. It's hard work and it takes a lot of practice. Muscle memory. If you've been in the military, you know what that's like. The other analogy is going to the range. When you're on the range, you need to control your breathing so you can squeeze the trigger, hit the target. So think about yourself on the range. That'll help. Now the other concept is here, post-traumatic growth. That from that trauma, every one of us has a chance to grow from it. That's the human condition. And we need to look for those opportunities to build these factors that we call resilience. So our growth can include improvements in our physical activity. That trauma, if we're going to cope with it, we need to be physically active. Our body needs that. It responds well to physical activity on a daily basis. So these are things that you need to build into your daily structure to help you in your recovery. Physical activity. The next one, social support. Improving our social support improves our resilience and allows us to grow. Therefore, group therapy in our VA system is very effective because it brings our veterans together. They can talk about their experience. It allows them to divide up the trauma, the suffering, and it multiplies the joy that people have and the positive experiences from their military deployments. Moral compass. Part of growing and recovering from post-traumatic stress disorder is having some religion, spirituality, philosophy that helps us continue on our path. A simple philosophy like this too shall pass can allow someone to get through hard times. But this is an important part of resilience that people need to keep in mind as they're building a plan towards growth. The next aspect here is active coping skills. Oftentimes people after a trauma become passive. They withdraw, they isolate, and that only leads to more suffering. So the more we can help veterans and yourself develop active coping skills, you're going to get better. And the final aspect is cognitive flexibility. In the military, you're often taught this is the way you solve a problem. And you can get rigid in that thinking. And many times, mental illness is a result of being too rigid in your thinking. So the more we can expand our options, expand our problem-solving skills, allows us to have cognitive flexibility, which promotes post-traumatic growth and can reduce PTSD. And that's the end of part 2.